Hello and welcome to Tidepool's first webinar talking about Tidepool for telemedicine. My name is Christopher Snyder. I'm community manager at Tidepool. I'm here to help guide you and your patients and the rest of your team through this crazy time that we're experiencing right now, and most importantly, how to use Tidepool to facilitate your telemedicine appointments with your patients. To start today, I'm going to be talking with Dr. Salih Adi. He's a pediatric endocrinologist and the chief medical advisor at Tidepool. He's going to be demonstrating how he uses Tidepool to evaluate patient data to make his clinical recommendations with his patients, and hopefully get you started with how Tidepool can work with you and your patients for your upcoming telemedicine appointments. After Dr. Adi walks through his presentation, I'll be going through a live demo of Tidepool software so you can see everything in motion. Throughout all of this, if at any point you want to pause this video and evaluate all this material for yourself, tidepool.org/telemedicine is the place to start. From there, you'll be able to access all the materials that we have available to you. If you have at any point any questions about anything you've seen, any questions you have about the software you've seen, about getting started, about using Tidepool, about having your patients use Tidepool, support@tidepool.org is the email address you're going to want to use for that. Without further ado, I'm going to click a couple of buttons on this meeting link and show you Dr. Salih Adi. Dr. Adi, good morning.
Good morning, Chris.
So as mentioned, Dr. Adi he's a pediatric endocrinologist, chief medical advisor at Tidepool. He's been around with Tidepool since the beginning, back whenever it was Green Dot Diabetes, for those of you keeping score at home. Dr. Adi has prepared a nice presentation to walk through everything that he likes and enjoys about Tidepool. And from there, I think, Dr. Adi, it's up to you. So go ahead and take it away.
Thank you very much, Christopher. Good morning, everyone, and let's jump right in. Our objective today is to review the use of Tidepool in general for pediatric diabetes visits, whether it's in the clinic or in telemedicine visits, and review some case studies that will help provide some examples on how to use it. And then Christopher will take it over for some technical review and how to set it all up for you. We use Tidepool in our clinic at UCSF exclusively for all patients, whether it's telemedicine visits or it's in-person visits. That we do that because Tidepool has several advantages. One is that it is device agnostic and it's really simple to use. The onus of uploading the data goes to the patients so that they can upload all of their devices at home and upload their data at home. So their data is ready when they come to the clinic. So we don't have to do that in the clinic. Our staff don't have to do the uploading anymore. And actually, it's half of the job. It's already done automatically, because if they have a CGM, the CGM data is automatically uploaded to the cloud every 3 hours. So anything that goes to the phone, because the CGM data is all available on a smartphone. From there, the Tidepool mobile app can take it and then upload it to the cloud automatically. So for most of our patients, actually, their CGM data is uploaded, and what they need to do is upload their pumps at home, and the process is very simple, as you will see in a few minutes. And it also, because Tidepool, actually, the way the data is presented, it shifts the focus to time and range instead of hemoglobin A1C. We tend to focus more on time and range than A1C, and this is very relevant to telemedicine when there is no A1C done. The conversation focuses more on time and range, and the way it's presented, it becomes more obvious, and it's the focus of the screen where you see time and range. And also, the use of Tidepool allows data review between visits so that the patients don't need to be there all the time, don't need to come in for a visit. We can do a lot of data review, whether with the patient or without the patient, as long as they can upload the data from home. And the ability to upload it from home makes data review between visits very possible. And it's all free. All of this is free. We don't charge patients. We don't charge the clinicians who use it. It's available for anyone, and they can sign up for an account and use it anytime. And by the way, just want to remind you that it is a reimbursable activity for reviewing the data. As long as it's done every 30 days, you can submit a bill for reviewing data in Tidepool or any other software that allows you to review the CGM data. And I think Christopher will talk more about the codes and the billing later on. So when I sign up for Tidepool, I log in and I go to a patient's account, this is the landing page that I end up at, which is the so-called trends view. As you can see, there are four different views that we can click on. And the default landing is on the trends view because it gives me a big picture kind of view of where things are over the previous either 1 week, 2 weeks, or 4 weeks. The default is 2 weeks, but I can click on 4 weeks or 1 week and it can do that. I can also choose which days of the week that I want to demonstrate here, whether I want to see only Saturdays and Sundays, so I can unclick the others, or if I want to see only Wednesdays or Wednesdays and Thursdays because of some sports activity that happens on those days. I can click on those as well, and the data will be presented for only those days. And on the right side here, this is the important sort of time and range bar that's in the green zone, in the green color here. So anything that's between 70 to 180 usually shows up here. It's calculated as the percent of time, the percent of data that's falling in that time range. And for this particular patient, for this particular 2 weeks here between February 5 and February 18, she was unfortunately only 25% of the time in the target zone, in the green zone, and 42% of the time in the high, meaning over 250, which we call the purple zone here. In reality, she was above range for the combination of this. This is 180 to 250. This is over 250. So she was clearly high all the time, or most of the time, and she does not have any hypoglycemia events at all. And we can see that here visually in this graph, which represents the median here of each day, as well as all the interquartiles here. And we can see that she's in the green zone only for just a couple of hours early morning. Then after the rest of the day, she's just high all the time. So clearly suggesting that something needs to be done. And we actually make a bunch of adjustments, and I'll get to that in a second. And just to see how things sort of progressed from here, we go to 2 weeks later and look at the same trends view, and we can see, generally speaking, things are much better. She's clearly doing a lot better at night with, spending more time in the green zone here in range. And during the daytime, she's still a little high, but it's not as high as it was before. And if you want to compare the statistics here, we can see that that green zone here, remember, it was only 25%, and now it's up to 59%. So that's clearly a much better picture that we're looking here. And then this dark purple here over 250 went down from 42% to 16%. And down here, I want to point this out, which is the glucose management index, which is kind of the equivalent of the estimated A1C based on the data that's presented here. And I didn't point out that in the previous slide, it was actually an estimated of 9.0 A1C. And after all those changes, it's dropped to 7.7%. So that's a big difference. And without having the patient actually do an A1C coming to the clinic or going to the lab, we can get an estimated A1C based on the data, which is extremely valuable for telemedicine visits. So looking at this big picture here, I can see that the daytime, it still needs some work because she's running high. And in fact, it goes higher and higher as the day progresses. And if I want to look at what's going on here and see if we can make an adjustment here, then I go to my favorite view, which is the daily view here, right here. And if I click on that, I'm going to go to see you day by day with all the details of what happened on that day. So we go to a daily view that shows 24 hours at a time, but you can scroll right and left. It's all continuous and go back and forth from day to day. Or we can click on one of these arrows that basically goes 24 hours at a time and show you the screen from the day before or the day after. And just a quick orientation here. This is the time, and it's all in 3-hour increments. And then this is the CGM data, obviously, as you can see. And these are the carbs entered here in this yellow circle with the numbers in them. And these are the boluses that were given. And if I hover over any of these columns, it's going to give me a little bit more detail about the bolus and how it was calculated and how much was given, as you will see also in a couple of minutes. And at the bottom here is the basal rate. And the dotted line indicates the actual settings in the pump. And all of these changes, this is the actual delivered basal. And you can see that these changes are very frequent because this patient is actually using a closed loop system that adjusts the basal rate up and down based on her CGM data. So as we saw earlier, Jane is currently 10 years old and she was diagnosed at age 6, so she's had diabetes for a while. And the nighttime blood sugar control is actually pretty good, and her closed loop system is working fairly well to keep her in the time, in the range here, in the green zone. And then she wakes up and then she starts eating, and then she goes up and she goes up. And the more she eats, the higher she goes. And she basically stays in the purple zone pretty much for the rest of the day until she finally goes to sleep. She's snacking a lot. And one thing that I would say here is, well, perhaps that she's not getting enough insulin for the carbs. Her insulin to carb ratio is not enough, or that she's not counting her carbs correctly and she's really underestimating the carbs, or that her correction doses are not enough, or perhaps her basal rate is not enough also, or a combination of all of those things. So we can take a look at a few other days, and fortunately, the very next day, we have an opportunity to see that again, the nighttime is pretty good, and then she wakes up and eats breakfast, and it goes way high, and then starts to come down, and then it goes up again. But then she has a period of 6 hours with no food here, and without food, actually, her blood sugar does eventually come down, and her correction doses do work, suggesting that her correction ratio may be fine and her basal rate may be okay. However, it's really the insulin for carb ratio that's not enough, or that she's not counting her carbs well enough or accurately enough. So we talk about it because I'm looking at the screen and sharing my screen with a patient during the televisit. And we're pointing all of these out and we're discussing it together because we see the same thing. And we talk about this, and the mother says, yeah, I think we could probably use a little bit better carb counting. I don't think that we're counting it correctly. We're underestimating because we're worried. And I actually want to see what her carb ratio is. So I hover over this bolus here, and it gives me this little box here that says, at that time for this bolus at 10:29, the blood sugar was 129. She ate 40 grams, or they entered 40 grams. There was a little bit of insulin on board here, and the pump calculated and delivered 4.44 units. Now, the insulin to carb ratio at that time was 1 to 9 grams, and the ISF, or the correction ratio, was 90, and the target was 110. Now, for a 10-year-old, 1 unit for 9 grams of carbs is actually pretty aggressive. That's a lot of insulin. And I don't think that we need to go any higher than that. So I kind of go with the parent here telling me that, no, I don't think we should change the carb ratio. I think it's strong enough. We should probably just pay a little bit more attention to the carb counting. And I suggest that we also change the correction ratio a little bit, because if someone really needs 1 unit for 9 grams, usually they need a little bit more correction for insulin for correction. So instead of 90, we're going to go to change it to 75. And we made those changes, and we talked about improving the carb count. Now let's see what happens. A couple of weeks later, 3 weeks later, I actually want to see what happens. So without even needing to call the parents and tell them to upload anything, because the CGM data is already in the cloud automatically, I can just log into the patient's account and see how things are going. And we can see here, this is a much better picture. In fact, on this particular day, she's spending a lot of time in green. 79% of the time for this 24-hour is in the green, and she has no hypoglycemia in red at all. So she's clearly doing much, much better. And just by seeing this, I send her a little email, good job, and that's it. We don't have to do anything. I don't have to ask them to do anything differently or uploading the pump. This is fine. It's okay. Now let's go to another example. This is an example of a patient who does not have a closed loop system. This is Bonnie, who's 19. She was diagnosed a long time ago, and she was a child, a toddler. And she is now in college in Australia. This is why her units here are in millimoles per liter. 4.0, which is equivalent to 70, and the 10 is equivalent to 180 milligrams per deciliter. And we can see that here, this is because in Australia now, January is actually summertime for them. So she's sleeping late and waking up almost at noon, but her blood sugar when she wakes up is almost always on the low side, clearly suggesting that her basal rate here is too high. It's dropping her all night steadily. Her basal rate is too high. But we don't take it just by one day. We want to see the trend being actually consistent. And we go to the next day, and almost the same thing is happening. In fact, she dropped low for several hours before she finally woke up. And she woke up early here at 8 o'clock because she was low. She treated her low with a little bit of juice and then went up and then back down again and again, suggesting that her basal rate is too high. And we go again to another day, it's the same pattern happening, and another day the same pattern is happening. And I'm showing her all of this on the screen and saying, look, if you see this happening every single day, either do something about it or send me an email and say, can you please take a look at the data, and I can log in and look at it and make a suggestion. So here we clearly confirm that the basal rate is too high. We agree on that, we lower the basal rate. And again, a few weeks later, I go back in to take a look, and she's doing much better. Obviously, this is a much nicer, steady line, and she can sleep in all the way till 1 in the afternoon, and she's okay without the risk of hypoglycemia. And this is another patient, Ursula, who's 17 years old and diagnosed at age 3. And this is just to show an example of a patient who's using Tandem's basal IQ with how the events of suspension and resumption. So S is for suspend, resume, suspend, and resume. It's doing a very good job in the evening time and at night, maintaining her blood sugar nice and tight, actually almost in the 90 to 110 zone for all of the night. Unfortunately, she wakes up in the morning, eats her breakfast, and doesn't bolus for it, and then she goes way up. But a couple of hours later, she decides to actually correct her high blood sugar, takes a correction bolus, and this is an opportunity to see how is that working. And it's actually working very well. It's coming down 2 hours later, and if she didn't eat again, it would have come back down further, suggesting that her correction ratio actually works okay. And from this, we can say, well, her insulin to carb ratio is also working okay, maybe not optimal, but it's not too bad. And her basal rate works great, and it's preventing the hypoglycemia with all these suspend and resume. So the discussion here is not about her insulin regimen. This is a discussion about remembering to bolus for the food. And visually speaking, what I love about this is that we can tell her, she can see this. Instead of talking about that A1C thing, we're simply talking about this green bar right here. We want it to be 70% or higher. And I can show her that she's so close. It's only 66%. She's really, really close. With just one extra bolus, remembering to bolus before breakfast, she can do it. And that's hopefully sometimes motivating for some of these teenagers. And she will take at least one bolus before she does it. And then we'll see how that goes. This is the same patient now. What I was able to convince her is, okay, well, if you forget to bolus, maybe let's do the closed loop system that actually gives you insulin, gives you more insulin. So switching from Tandem's basal IQ to Tandem's control IQ recently, and see how that works, because if she forgets to bolus, it will actually increase her basal rate and bring it back down. That's exactly what happened here. So again, for the nighttime, it's working fine. She wakes up and she does bolus for breakfast and bolus for breakfast again, and that works really well. But then unfortunately, she eats again here and doesn't bolus for this one, and the blood sugar goes way up above 250 and 300. And then the system takes over, starts giving her extra little boluses here, increase her basal rate to try to bring it down, and eventually it does actually successfully bring it back down to the green zone. So this is working fine with her, but again, demonstrating for her that, okay, fine, you're not going to remember to bolus every single time. The system will work better for you, and it's okay. And one other reason to look at, one other point I want to point out here is how even with a closed loop system that can adjust the insulin up and down, she actually does not need those adjustments all night, simply because her basal rate has been optimized for this patient to actually work fairly well. And the system doesn't need to adjust it that much. Tiny little adjustments, a little up here, a little reduction here in the basal rate, and the rest of it is just cruising on its own. And when we see this picture, not much adjustments, we get a nice smooth line for the night for the blood sugars. And I'm going to show you to contrast this with the next slide with a patient who's also using a closed loop system. But look at the basal rate here at night. That's having to work extra hard, constantly up or down, up and down, doubling the basal, reducing the basal to 0, suspending the pump, resuming the pump, just to keep her blood sugar, to keep his blood sugar. This is Mike, who's 11 and diagnosed about a year ago, to keep his blood sugar running here in the green zone. It's working hard, suggesting that maybe we need to optimize the basal rate. And the difference here is that if we don't optimize it, we're going to get a zigzag line following all these extra changes in the basal rate, as opposed to the smooth line that we saw earlier for the other patient. Here's the next day for this patient. We made a little adjustment in the basal rate, and actually Mikey now is doing much better for this part here, simply because now the basal rate is actually is pretty good, and the system does not need to adjust it, and we get a smooth line, as opposed to here. It's still adjusting a lot, so we probably need to make some further adjustments here, and that's what we will do next time. But the other thing here we see is that the nighttime is good, but then as soon as he wakes up and starts eating, it goes higher and higher and higher, suggesting that we probably need to do an adjustment in the insulin to carb ratio as well. So we do actually increase that, and this was just a couple of days ago. So we'll see how that goes. So when I see this and I want to make some adjustments either in the basal rate or in the carb ratios or anything else, how do I do it, especially for telemedicine if I'm doing this without the patient in the clinic? I go to the device settings right here, and if I click on that, it's going to give me the current settings in the pump. This is just an example. This is not that same patient that we were looking at. So we have the times, we have the basal rates, the target blood sugar, the carb ratios, and the correction factor. And it's telling me here that this was a tandem pump, so I know what kind of limitations the tandem pump can do in terms of the increments in basal and carb counting, and when it was last time uploaded. And I take this and I go to copy as text, and if I click on that, it's going to copy it, and I go to my email and I paste it, and I make the changes, and I send an email to the patient and say, these are the new changes that I want you to make. And then I make a copy of that and then take it to my electronic medical record. We use Epic, and I paste it in there to make sure that we have a copy of the most recent recommendations in the chart as well. So if you love data and you love telemedicine as much as I do, you'll love Tidepool. And here's Christopher to walk you through how to set it all up if you decide to use Tidepool for your patients. Christopher.
Thank you, Dr. Adi. No pressure to follow that up. All right. So again, I'm going to take you through now the setup process for Tidepool from the perspective of a clinician. I'm going to walk through to show you a couple of Tidepool's data visualization in motion. I'm going to show you what Tidepool Uploader looks like, so you have an idea of what your patients will be dealing with. We'll actually get to use at home as well. Throughout all of this, one thing to keep in mind is that Tidepool software is free for you and your patients. Again, if you have any questions, support@tidepool.org is the email address you should be using. And if you want to, again, take a look at the additional resources we've created for you, your team, and your patients during this time of a telemedicine first approach to diabetes care, tidepool.org/telemedicine is the URL you should be going to. So now I'm going to share my screen, and we're going to have a bit of a tour through some resources and some screens that you can look forward to if you want to take advantage of using Tidepool with your clinic and your patients. First is the sign up page. If you go to tidepool.org/sign up, you'll be taken to this page right here. From here, you would be able to click clinician account, continue. And to get started with a clinician account, again, this is entirely free for you and your patients. For your clinician account, all we need is your name, your email address, and your password. From there, you'll receive an email to confirm your identity and continue to proceed through creating your clinician account. Once you've created your clinician account, there are a couple of things that you're going to want to keep in mind. One is that the only data you'll have access to are for the patients whose either accounts you've created or for patients who created their accounts at home prior to their first visit with you, and they have to choose to share their data with you. If you want to actually create accounts for your patients, that can be accomplished using Tidepool Uploader. And that's what this software is right here. Tidepool Uploader, again, this is free software for you and your patients. This can be installed on Macs or Windows PCs. For Windows users, you may be using Windows 8.1 or Windows 10, 32 and 64-bit. Having this installed on your computer is going to be required if you want to be creating patient accounts. If you are using a network-based computer that your IT staff would have to be managing, then you're going to want to have your IT staff send an email to support@tidepool.org so we can make sure to share with them our technical documentation to get Tidepool Uploader installed on your work computer. Once you've logged in to Tidepool Uploader here, I've logged in right now as our demo clinician, Dr. Sally C-Star, so you'll be able to understand exactly what you will see whenever you're using Tidepool Uploader with your own clinician account. To create a new patient account after you've logged in, you click Add New. You can enter a patient's first full name here. So let's do Xander, how about Xander X-Ray? At Tidepool, we love our water-based puns. If you put in a date of birth, and to get started here, actually, all you need are your patient's full name and date of birth. We have an optional field here for medical record number. This is optional. This is something for you to keep track of if you want to match the patient's Tidepool account with your internal record keeping system. And additionally, we have a field for email address. Now here, during this telemedicine first approach, this email address, while it says optional on the screen, I'm actually going to go ahead and call it required. What happens here whenever you put in an email address is that the Tidepool system will send your patients an email letting them know that you've created a Tidepool account for them. Your patients will then be prompted to click a link and agree to our terms of use and privacy policy. And from there, they will have claimed the account that you've created for them. And then and only then will they be able to upload data to their account from home. So again, if you are going to go ahead and create all the accounts for your patients through Tidepool and Tidepool Uploader, including this email address in here is going to be required. So we're going to go ahead and actually do that right now. We're going to create a demo account for Xander here at tidepool.org. And now we've actually created an account for Xander X-Ray. Once you've done all of this, you can actually go through and click through and assign choose the devices that your patients are using. Using Tidepool Uploader, we support uploading a variety of devices. I'm actually going to walk through all of our supported devices in a moment here. But for Xander, let's go ahead and just say that he is using a tandem insulin pump. And from here, we can click Done. The next thing that's important for Tidepool Uploader is the time zone. Because patients are likely not moving anytime soon, especially during this time of shelter in place. We're going to go ahead and select Eastern time zone because that's where I am currently living in Atlanta, Georgia. And then for Xander, if he were going to upload his insulin pump, he would actually simply download Tidepool Uploader on his own computer, click install, log into his account, connect his insulin pump with a USB cable, which I'm going to do right now because I'm wearing a tandem insulin pump. I'm just going to go ahead and upload my data to this Xander X-Ray demo account. We're going to take a look at what this looks like in Tidepool in a moment. If you've seen a progress bar scroll before, once you've connected your device with the USB cable, you click upload and you're ready to go. Because this is the first time that I'm uploading data to this demo account, or in any time there's a first upload to a patient's account, typically this upload is going to take above average time for us. Given once a patient has uploaded data to their account the first time, subsequent uploads will typically take much faster because we're only uploading new data. Because of this, we advise that you send patients a notification a few days in advance of their upcoming telemedicine appointment to remind them to upload their data, to make sure that their software is up to date, to make sure that they have successfully uploaded everything. And we actually do provide a pre-drafted email for you to send out to your patients to remind them to upload their data. As this is going, I'm going to walk through the rest of our supported devices here. If you go to tidepool.org/devices, this will take you to a webpage on tidepool.org, our marketing site. This will walk you through all the supported devices that are compatible with Tidepool's software. As you scroll down, you can see there's a lot of colorful icons here. I'm going to focus on a couple of highlights for you and your team and your patients to keep in mind as we talk about the compatibility of Tidepool software. On the insulin pump side of things, Tidepool software does work with Medtronic pumps, including the Medtronic 670G, 630G, and 530G. All these Medtronic pumps are uploading directly to Tidepool without the use of CareLink. For insulin pumps, we do support uploading from the Omnipod and Omnipod Dash PDM. From Tandem's pumps, as mentioned, I just uploaded data from my t:slim X2. We actually support uploading data from all of Tandem's products up through Basal IQ. Technically, you can have patients uploading their data from pumps that are running Control IQ. At Tidepool, we still have some work to do on the technical side of things to fully support Control IQ and displaying the additional Control IQ related events, including things like activity mode or displaying which boluses are auto bolus. But for the time being, we actually do support displaying the data, just not all of the different events related to Control IQ. But your patients can still use Tidepool software to upload all of their pump data into their Tidepool account. Additionally, if you still have patients that are using an Animas pump, particularly the Ping and the Vibe, we do support uploading data from those pumps while they are still using them. From the CGM side of things, we do support all of Dexcom's products, G4, G5, and G6. Depending on the device that your patient is using as their primary Dexcom receiver, be it the Dexcom receiver itself, an iPhone, an Android phone, or their t:slim pump, there is a different preferred path to upload data regarding their CGM data. Tidepool has support resources to fully detail and document the specific path for uploading Dexcom data, depending on their preferred Dexcom receiver. And again, support.tidepool.org is the place to go to review all that documentation then and there. From Abbott, we do support uploading data from the Freestyle Libre. The catch here is that we currently only support uploading data from the official Libre scanner. So if you have patients that are using an iPhone or an Android phone to scan their Libre sensor and view data on their phone, or using Libre View, unfortunately, we cannot view that data in Tidepool. But again, if your patients are using the Libre scanner, we can review that. They can upload that data to their Tidepool account. You can see that as well whenever you log in to your free clinician account. For Medtronic sensors, provided they're connected to a supported Medtronic insulin pump, we do support reading Medtronic CGM data from the Enlight and Guardian sensors. For blood glucose meters, there are a lot here. As I scroll down this webpage, you can see. The thing that I ask of you as you are considering using Tidepool and our free software for you, your team, and your patients is to review the blood glucose meter section of this page and send an email to support@tidepool.org if there's a meter that you know that your patients are using that we do not yet support. Feedback from the clinician community in particular helps us prioritize the work that our engineering team does to add support for more blood glucose meters. And we do update Tidepool Uploader regularly with support for more devices. But in part, that work is prioritized based off of the input that we receive from you. So again, tidepool.org/devices, click on blood glucose meter, take a look at all the meters that we do support, and let us know if there's one that's missing based off of the volume of usage that your patients are currently interacting with. Lastly, Dr. Adi had mentioned that in some of his sample patients that he has their CGM data uploading automatically. This is accomplished through Tidepool Mobile. This is our mobile application. This can be installed on an iPhone or an Android phone. In particular for patients that are using an iPhone, if they're using Dexcom Mobile, G5 or the G6 version, using an app like OneDrop or MySugar or Companion Medical's InPen, essentially any app that's writing blood glucose, carb, or insulin data into Apple Health on an iPhone, Tidepool Mobile can upload that carb, blood glucose, and insulin data wirelessly from their phone directly to their Tidepool account. And again, all this is happening for free. It's free for you. It's free for your patients. In terms of all of our device support, again, we update this page as often as we can. Whenever we add support for new devices, I encourage you to keep this page bookmarked if possible, so you can always use as a reference point for the different devices that we do support. Lastly, from this page is one of the things that I didn't mention whenever I was walking through all the different devices that we have support for. As you hover over each of these different icons, you see the learn how to upload text prompt shows up here. If you click on any of these cards, it will actually bring you directly to the upload guide for a given device. So for the Medtronic pumps, in particular the 670 and 630G, we actually require the Contour Next 2.4 meter to function as a communication device between the computer and the insulin pump. These upload guides exist for all of our supported devices. So again, when you start on tidepool.org/devices, any device in question, you can click on the card in question. It will bring you right to the support article that will walk you through the exact process for uploading the data from those different devices. Once you've actually got everything up and running and it's time to review patient data, I'm going to close a couple of these browser tabs now. And we're going to take a look at Tidepool Web. Tidepool Web is the free software that's used to view patient data. Dr. D so awesomely, that's actually not even a word, but we're going to go with that. So awesomely walk through a couple of his patients and show you what Tidepool Web looked like through those slides, and to show you what Tidepool looks like in motion. Tidepool Web, again, is the software that's used to visualize all Tidepool data. Google Chrome is the required browser to use Tidepool Web. Right now, this is Google Chrome that's running. You need to have Google Chrome installed on your computer to access all this data. Let's take a look at the Xander account that we actually created earlier in this walkthrough. And to start, I'm actually just going to focus on a couple of key things that Dr. Adi had mentioned in his walkthrough that I want you to pay attention to as you're using Tidepool to visualize your patient's data. First, from the daily view, Dr. Adi had shown you a couple of the sort of tooltips that pop up whenever you hover over any key piece of information that you see within Tidepool Web. What I want to do right now is show you what that actually looks like in motion. Again, this is actually my data, so you can see I am human. Here's a nice blood glucose reading of 296 according to my Dexcom G6 in the middle of the night, but the Control-IQ system was working extra hard to bring me back down. I can see this because when I hover over the CGM line within the blood glucose portion of the daily view, there's a timestamp and a blood glucose reading. When I look down to the corresponding basal rate, I can hover over this basal section and see the temporary basal that was executed based off of my scheduled basal rate profile and what the insulin pump was actually delivering for that time period. You can see as you move forward within the basal rate section, solid lines here indicate the scheduled and programmed basal rate that was delivered. So when we hover over this, you can see the basal rate that was programmed and the amount that was delivered for that duration. The dotted lines indicate the temporary basal. As you can see, overnight, we have an increase for temporary basal, and then in the middle of the day, you can see the basal decrease here because it is below the dotted line, including a full-on pump suspension around here. For the bolus events, as mentioned, here is me eating breakfast in the morning. When you hover over this, you can see, again, that full tooltip that shows the blood glucose at the time, carbs that I'm entering into my insulin pump, total amount of insulin delivered, and again, the insulin pump settings at the time of insulin delivery. And then we display all these settings for all the different events that are taking place here. So again, you can continue to use your mouse to hover over all of this data. As we scroll through on the daily view, our summary statistics will update on the right so you can see our time in range. Again, Dr. D, I mentioned focusing on staying in the green. I hit that 70%, Dr. D. All right. It was a good day for me, I suppose. Again, the average blood glucose based off of CGM data, total insulin for the day, including the basal and bolus breakdown. Again, these are highlighted as you're moving your mouse over. Total carbs for the day, again, based off what's been entered into the insulin pump, standard deviation and coefficient of variation, again, based off of CGM data. This display exists for as long as your patients have been uploading data to their Tidepool account. Now at this point, I feel like I'm just bragging. Here's 80% in range. And so from here, as mentioned, you have all the different days one at a time. If you go to the trends view, again, Dr. D had shown that as a point of reference to use that as a starting point for where do we evaluate the different sort of opportunities for improving insulin pump settings for the day. Here we have to start 2 weeks worth of data. If we want to start expanding or adjusting the amount of data that's being visualized within the trends view, we have a lot of options, as Dr. D had mentioned. Here we have 1 week of CGM data. Once this loads, there we go. 2 weeks of CGM data and up to 4 weeks of CGM data. I have only been using this pump for about 3 weeks, so I don't have a full 4 weeks, but you'll be able to see that here as well. Again, if you have a patient that has something like swim practice or some sort of regular exercise routine outside of this shelter at home policy, you can look at different days of the week and specifically filter for that with these options above. So in particular, if you wanted to focus on just the weekends, you could look at 4 weeks of just weekend CGM values and use that again to begin to evaluate what your patients are doing over the weekend and where there are opportunities for improvement with their diabetes settings. As you are adjusting the display settings here within the trends view, the summary statistics on the right will update as mentioned, so you can see the average daily time in range. As you're hovering over each one of these sections, you'll see the blood glucose targets. Here, my blood glucose targets are set between 70 and 180 mg/dL. Average blood glucose based off of CGM data, sensor usage percentage, GMI, standard deviation, coefficient of variation. All this adjusts depending on the amount of data that you have here. If you click copy as text from this screen, you can actually open a notepad or your patient notes. And let's bring that up here in my own notepad, and you can paste these summary stats that you see here as text directly into your chart notes. Again, as Dr. D had mentioned, when we're talking about using those CPT codes for remote monitoring and reviewing CGM data every 30 days, here's an example of the documentation you can provide to demonstrate the data that's coming out of Tidepool to help assist with that. The copy as text button exists on the trends view. It also exists on the basics view, which I'll show you right now. When you click, again, copy as text, all of the summary stats that you see on the right side here are available as text for you to paste into your patient notes. Lastly, the device settings. Again, this will show you what that looks like in motion. Again, copy as text, go to your chart notes, and you can click paste. And here you have the chart notes. Within your chart notes, you have that text value of your patient's device settings. And again, you can see what that looks like within Tidepool Web and within the charts or within the text formatting that you can paste. Lastly, one other option you have to get Tidepool data offline is this print button. This button is available, and you'll see from the basics, daily and BG log views, and we also display here within device settings. When you click print, the Tidepool application itself will generate a PDF that you can print out, or in the case of your telemedicine visit, save and attach to your EHR. This will include everything that you've seen from the basics view. The PDF will also include the last 15 days from the daily view. We'll also include, if you had it available, the last 30 days of blood glucose log data. So if you have a patient that is only uploading data from a blood glucose meter, for example, you can have 30 days in that exported printout, and including the PDF as well. Additionally, the PDF will include those pump settings. And again, this is a fixed PDF package. You can download all of that and attach it to your patient's EHR as necessary. Once you've completed reviewing patient data, again, because this is all happening virtually, it's all happening within your web browser, you click this care team icon at the top, you're brought back to the patient list search screen, and you can go through and look at data for a different patient that you have access to. And that in and of itself is the Tidepool for Web experience in a nutshell, if you will. Again, I want to highlight a couple of the resources that we made available to you on our telemedicine focused webpage. Again, that URL is tidepool.org/telemedicine. And that will bring you to this nice, lovely landing page that we built, and we'll be continuing to update as the days and weeks progress, as we continue to build out and update our resources for you, your team, and your patients. A couple of things I want to highlight for you first. One is a getting started guide for clinicians. Clicking here will eventually take you to a downloadable PDF for you and your team to review all the different steps that you need to get started using Tidepool, getting your account set up, getting your patient accounts created, and so on and so forth. Additionally, we have a resource focused on the CPT monitoring or codes for remote patient monitoring. This will take you to a separate page that will walk you through all the codes that we have identified that will reference the telemedicine visits that you're going to be taking advantage of using Tidepool. Again, this will help you hopefully pursue reimbursement. At Tidepool, we can't necessarily guarantee based off of the payer and the biller and things like that what's going to be taking place, but at the very least you have these codes as a reference point to begin that pursuit for reimbursement based off of those CPT codes and your interactions with your patients. We have this data available to you within the webpage form. There also is a downloadable PDF, which I'll show you right now, which will demonstrate the exact same thing. Again, you can print this out, save it to your computer, whatever you need, so you'll have access to that. We have links to helpful reference guides outside of the Tidepool ecosystem, but again, we have a nice chart for the code use, and the frequency that it can be applied for you. Additionally, on the telemedicine webpage, we have a bunch of resources that you can leverage to share with your patients. One is a getting started guide for them. This is also a downloadable PDF. Again, you can send this to your patients to help get them started using Tidepool and Tidepool Uploader and Tidepool Web. We have a Tidepool Uploader specific webpage or a guide that will walk them through downloading Tidepool Uploader, installing it, using it for the first time, helping them identify which USB cables are going to be used for their different devices. And additionally, we have a link to our broader support site. Again, support.tidepool.org is where you're going to want to go there. I'll show you what that looks like briefly. And here we have a friendly search bar at the top where you can use that to identify if you're looking for help with Tidepool Web, the daily view, the trends view, support for uploading a specific device, support using Tidepool Mobile. Any of that is available through our support site. Again, support.tidepool.org. Lastly, we've actually pre-drafted some emails that you can send to your patients. This is a public Google Doc, and we've again provided this text as a template for you as a suggestion for what to send to your patients if they're using Tidepool for the first time, or if your patients have used Tidepool in the past. Then you can use this text again as a suggestion. You can simply copy this and paste this into your patient's into your patient portal for a message you want to send to them to let them know that Tidepool is going to be the platform you're going to be using for their telemedicine visit upcoming. If the video that you're watching right now is not enough and you would like some more, you'd like an additional, more thorough walkthrough screen by screen of the entire Tidepool experience, we published a Tidepool for Clinicians demo video on this page. Again, tidepool.org/telemedicine. This is about a 12-minute full demo walking you through, again, Tidepool Uploader and Tidepool Web from the perspective of a clinician. Lastly, we have a bunch of additional information generated by the community from our peers at JDRF, Diatribe, and Beyond Type 1. Again, as we have more resources related to telemedicine, related to coronavirus and COVID-19, we will be updating our resources link down at the bottom there. Again, one more time, just to make sure you are well aware of this, Tidepool.org/telemedicine is the place to go to begin your effort to understand how Tidepool can work for you and your patients. And lastly, before we get out of here, I want to mention that Tidepool, again, is free for you and your patients. This is made possible by a generous grant from JDRF back in 2016 called No Clinics Left Behind. They saw the future. They knew that this type of resource was going to be essential and vital for clinicians, regardless of their resources, regardless of their location. And thanks to the generous support of JDRF, this software has been made available to all of you, to you, your team, and your patients for free. So again, we want to give a big thanks to JDRF for that. So that's where we are right now in terms of Tidepool for telemedicine. This is not the only video we're going to be putting out. We do look forward to creating additional content for you based off of your feedback and your questions. So if you have any questions that you'd like us to address moving forward, support@tidepool.org is the place to go for that. And we will look forward to seeing you in the future. Thank you again. Dr. Adi, let's give a little wave to the crowd there.
Great. Thank you very much, Christopher. And thank you, everybody, for watching.